All right. Good morning. Today, I'm talking with Dr. William Hill. How are you doing today, Dr. Hill?
Doing well. Thanks for having me.
Wonderful. Well, we're really excited to talk with you today and share your unique perspectives and all your exciting initiatives. So a little bit about Dr. Hill. Dr. Hill is a former University of Virginia, UVA, four-year letterman on the University of Virginia football team and a 2012 season captain. He was then a member of the 2013 Indianapolis Colts rookie minicamp and an NFL free agent. He obtained his Master's of Public Health at UVA in 2015 and completed his medical degree at Howard University College of Medicine, the best, in 2019. After graduation from medical school, he completed his orthopedic surgery residency training at the world-renowned University of Southern California and Los Angeles General Medical Center in LA. During the COVID world crisis, he developed Athlete Forever, which is an athlete-centric ecosystem that includes all the professional services that support athletes from the recruit to the retiree phase of life. So thank you, Dr. Hill, for being here. I'd love to learn and have our audience learn what has been your journey in medicine and how did athlete mental health become important to you?
So my journey in medicine, again, thank you for having me. A privilege and an honor being here. And I look forward to our discussion. But my journey in medicine, it really started, I would say, at an early age. I was exposed to our four founders, four fathers, four mothers that were inspirational and very impactful in medicine. I remember clear as day during Black History Month, which it is now, I would always dress up and be Dr. Charles Drew. And so that story resonated with me and really impacted me for, all my life to this point. And then from there, it just was a love of science, math, but also sports. And so, those, three things really, for me, it was a natural progression as I moved on to, undergraduate work. I majored in biology. But in that, the plan was always to do something that married sports and science. And so from there, I talked to my team physician at the University of Virginia, and I would meet with him, not formally, but infrequently, and just talk about, hey, what do you want to do after you're done playing? And at that point in time, I didn't know that he was really getting me to think about, my career, but it was at that point in time that, medicine became more of, I think I want to stay in touch with sports, but also delve deeper in the medical and sciences part of it. And so from there, I finished playing, had an opportunity to, compete and try at the professional ranks, but ultimately my path was in medicine and other pursuits. And so during my application year, I was able to do an accelerated MPH back at UVA that with a focus on health law, policy, and ethics. And during my practicum, I was able to intern with the Office of Governmental Relations at the American Academy of Orthopedic Surgeons. Again, also one of my passions is advocacy and policy. So I was able to marry that with the orthopedic surgery and sports medicine side of things. And then I was accepted to Howard Howard University College of Medicine during my MPH year. And I knew I wanted to do orthopedics and ultimately sports medicine. And so I worked hard during those years, and I was fortunate enough to match in orthopedic surgery and had good mentors and got through orthopedic surgery residency and had great training, great experiences, and great patients that taught me a lot. and ultimately matched into a sports medicine based fellowship. And then I'll be transitioning back to a sports medicine practice in Virginia, where I'll be the director of sports medicine, as well as regenerative medicine this September. And
Congratulations.
thank you.
Yeah,
So that's my journey in medicine. I know
that's
it was
amazing.
a long response, but
No, that I love that information. I don't know if you know, but I also served on the Council for Advocacy and Government Relations for the American Psychiatric Association for
awesome.
several years. Yeah. And I think it's really great, that foundation, when you have a heart to give back and to want to make change. There's only but so much we can do in our immediate sphere of influence. So once you get involved with like policy making, that's when you can make an impact that helps so many more people. So that's wonderful that you've done that. And I also think it's important to point out the value of having representation in front of you and someone that's planting those seeds and invested in your future and sees that possibility and potential in you, because it sounds like that made a big difference to have your team doctors do that when you were still an athlete. So,
Correct.
Yeah. Tell me, you have an interest in the mental health aspect of sports. How did that come about?
Well, for me, I approach everything, my practice of medicine, my life, in a holistic manner.
Mm-hmm.
And specifically the injured athlete. We do a great job in our surgical technique proficiently. The rehab team does a great job. The athletic trainers do a great job to return them to play. But one of the main aspects that is we're still improving on, and in some settings and spaces it's not even there, the mental recovery from injury. And this is just one aspect of mental health in sports, but it's one of the more immediate ones that we deal with. And so, if someone isn't mentally ready to return to sport, their re-injury rate is higher, the new injury rate is higher, their performance level is lower than their pre-injury level. And so one of the slogans I used to say when I was, an athlete was mind right, body tight. And
I like that.
It seems simple and rudimentary, but really your mind has to be right first before your body is really primed for peak performance. And so for me, I got involved also because in order for athletes to truly be optimal in their performance, their frame of mind and all of the different components that make up mental readiness and wellness have to be in order. And so helping the athletes holistically is really what drove me to, partner with professionals like yourself and to get in the game. Because as orthopedic surgeons, we think our job is done once. A lot of orthopedic surgeons think that when their job is done, once the surgery's done or once the player returns back to play. But, that's just the tip of the iceberg. And that's part of why I also started some other ventures, is because us as sports medicine physicians, we may be the only physician that an athlete sees.
Absolutely.
And so we have to take care of them, the entire aspect of the athlete, or total athlete, or whole athlete care. And so for me, the mental part of it is maybe even more important than the physical aspect of it.
Well, they're definitely tied together in a way that we can't separate. I'm wondering, in your experience working in your field thus far, I mean, you clearly have plans of making sure that integration is there with the people that you work with. Do you see from your colleagues, not necessarily they're on the same page, some may be, about that integration, but anyone who are hesitant, or is there collectively like a culture of pushback against that, or being concerned about that? I remember, I think this was in medical school. It was in this ortho specific cartoon, but it was a surgical one. And it had the surgeon standing there explaining what they had done and saying that the surgery was a success, but the patient had passed away. And he was telling the family that. And it was kind of, I mean, that's an extreme, and it was meant for comedy example. But, you know, some people are very tunnel visioned about whatever their field is, not just in surgery. So I'm wondering, how accepting do you find that your colleagues in the field are of that type of mentality, or have you seen any place that is actually implementing the integration of mental health services so they can have that better outcome afterwards and improve their return to sport?
I think we're very early in it. I think some of the professional organizations that have the resources at their disposal, you know, like the NFL, you know, they have like their game day team, they have like 7 or 8 different medical professionals that are at the game. So the bigger organizations that have the resources, they're starting to do it in their medical team portfolios. But, you know, in I guess my orthopedic and sports medicine societies that I'm a part of, it's not that there's pushback. I think that it's so early in the evolution of athlete care that there is not we're in the phase of innovation adoption or change adoption. I think we're in the early adopter phase. And so it's not that people are pushing back. It's just that it's the way that people have done it for so long that some people don't see it as a need, or don't know that, you know, you can get better outcomes by incorporating this colleague or this other discipline to your care. And so some of the bigger teams are doing it. Some people maybe just see it as research still, but there are articles that show that, you know, the mental readiness after ACL surgery really doesn't get back to pre-injury level till 2 years. But most of the time we're getting people back. People are pushing it to 9 months, 12 months. So the graft may be ready. They may be physically ready, but mentally they're not ready. And we see that re-tear rates are higher up to about 2 years after surgery. So there's a correlation between injury level and mental readiness. And that's just, you know, that singular pathology. And so what, you know, it goes deeper. What about a patient that has ACL tear, but has known concomitant depression, anxiety, ADHD, or other mental conditions that are being managed?
Right. Absolutely. So for people who are working in the mental health fields, especially psychiatrists, that agree with that and see how they can be helpful, what are your recommendations for them to become a part of that team, or not necessarily at the professional level, but just in general, the team of caregivers, the orthopedic surgery and sports medicine team, PM&R, all the people who are helping to get the athletes back to ready for play state? What are your recommendations, or what are your thoughts on the best way to approach that, to be able to be that help, even if it's outside of the practice or group?
Yeah, I'll address that, and I'll circle back on the previous question. So
Sure.
I think resources are huge because we're both based in Southern California, and they're, you know, private schools at the high school level that have resources to a performance coach or sports psychologist or psychiatrist that is affiliated to the universities. But some of the public schools, they don't have that. We're still fighting to get athletic trainers to be on site in schools. And so the resource allocation piece is huge because it provides access, and access increases care. We know that. And it decreases barriers, which helps outcomes. So I think access is the first part to get that, to help with that question. But to increase the interdisciplinary team collaboration, I think it's being available, reaching out. If you're, you know, if you're in a university setting, obviously that interdisciplinary collaboration is more natural. It's welcomed. Right. It's part of the environment. But if you're a private practice practitioner, it's like when you develop a practice, it's reaching out, extending that olive branch, saying, this is what I am working to do. I see that you're doing this. I think I can, bring value to what you're doing by doing X, Y, and Z. Can we collaborate? And I'm not necessarily impeding your workflow, but actually increasing value in helping your workflow. Some people, are open to that, but then some people may respond with, hey, I want to see the data. So, sometimes bringing data is needed as well. But I would say extending the olive branch, because you never know something it's like one of these things in medicine, right? You never think of a diagnosis that you've never seen.
Exactly. Yes.
And so some people don't even think of it as an option if they've never seen it or heard about it. And so I think exposure is huge. Exposing sports surgeons or sports physicians to this additional, actually it's sports medicine as well. This additional aspect of sports medicine that needs to, be brought on and highly integrated into the sports medicine team.
Yeah.
I don't know the stats, and someone needs to do this paper, and it's an easy paper. But the percentage of professional athletes or college athletes that have some type of that are dealing with mental health challenges or conditions, because I think if you bring that data to people that are just used to doing surgery, but also being on the sideline, it's saying, hey, 50% of your players may be dealing with some type of mental health challenge that could affect their musculoskeletal injury that you're treating.
Absolutely. Absolutely. Two things that you said that made me really think of other connected areas, because number one, when you were talking about not getting in the way of the workflow, I think that's part of the importance of talking about these topics and people really understanding what sports psychiatry and sports psychology are. So I think a lot of thinking about coaches and teams worry about what's being said, or they getting in the athlete's head in a way that's going to hinder their performance or contradict what they're trying to get the athlete to think or do as a part of their training. But that's not the role of the mental health professional at all. So when you have someone who's skilled in sports psychology and sports psychiatry, we're very aware of what our role is and how we can help in a way that is collaborative. And I think making that more known would be helpful. And you talked about the research that needs to be done and letting people see the numbers, but also recognizing that the numbers are likely very highly underreported. Yeah, because of the fact that there's a stigma that's involved with mental health. So I do think bringing those numbers are important, and then emphasizing the fact that there's probably more that we don't know about because of those issues would be another thing that I think would be helpful for people to understand. I wonder if it would become similar to in plastic surgery, where there's pre-surgery mental health evaluations that need to happen to make sure someone is ready for whatever procedure they're having. If that's something that would be helpful in orthopedic sports medicine as well. And then that screening could be done, and then connecting them with someone who could get them ready even beforehand, so that your outcomes are better afterwards. So something to think about for sure.
So to that point, so not most, but a lot of spine surgeons, joint replacement surgeons do integrate a depression screening / scale before surgery. Some sports surgeons do, but less so. But it's starting to slowly be it's a known risk factor for not as good of outcomes if patients, do have those additional comorbidities and challenges.
So that's great news that's happening. And hopefully other things like anxiety measures and other conditions can also be incorporated and studied to show how they impact outcomes.
The next step is to take action, which is not really being done in the sense that, okay, we have a score that shows us they have this comorbidity, which equates to not as good outcomes as soon. But, very low numbers of those result in either being referred for pre-surgical, evaluation by a psychologist or psychiatrist to help them if they, do need intervention. And so it's almost just like it's data that they have, but not acting on it.
What do you think is the reason for that when it's known that it impacts outcomes?
It may affect workflow, delay surgeries, or people may think that you have to refer and then they may end up not seeing someone for months. And so, or there may be a thought that this is something that should be quarterbacked or handled by the primary care doctor. And so there's so many levels to why that data may not be acted on actively. And so, yes.
Understood. Thank you. Thank you for explaining that. So tell me, you do a lot of work with high school athletes. How do your programs aim to help them in particular?
Of course. And so the high school athlete is at the beginning of the pipeline. High school athletes produce all college athletes. High school athletes produce all professional athletes. And so they should be receiving the most investment, because if we can help them, we will help them be better college athletes and better professional athletes and be equipped to have a life full of success and meaning. So that's why I am focusing on helping them. And so how we aim to do that and are doing that, I've developed the Athlete Forever platform, which is an athlete-centric app built for the athlete by the athlete that has all the support services that they may need while they play and then also after they're finished. And so those support services or professional services that are available for them to connect with organically are the mental health professionals, sports medicine physicians, sports agents, sports attorneys, financial professionals, nutritionists, dietitians, religious or spiritual counselors, university representatives for guidance on career paths and majors or exploration for graduate professional degrees thereafter, and potential employers so they can inquire about potential internships or employment opportunities after they're done playing. And so all of that, if they get a solid foundation and really develop their executive team or C-suite team with these professionals, it will help them in their guidance in life moving forward. And so also on that same topic, we are working to develop the first high school and youth sport award ceremony that would rival the ESPYs in a sense, but also in that same time frame, we're working to do a mind game summit that handles all brain and mental health discipline, from religion, spiritual health, performance health, substance use management, also any medical diagnoses that may need to be managed. And so we're looking to do that, and also concussion health. And so we want to help all athletes, not just a select sport, but we want all athletes to benefit from having their mental game or mind game sharp. And so that's also what we're working on. I know that was a long
That's okay. No, this is great
question.
information. You're providing a lot of great information, so thank you. I'm curious, so for your mental health conference, is that education specifically just for the athletes, or do you plan to have education for people who work with them as well, so they can better work with the athletes.
Well, I think, that's an innovative approach that I think we can incorporate.
Mm-hmm.
Obviously, it's a lot when you're doing the inaugural conference on any topic.
Mm-hmm.
But I think if we don't do it this year, it's something that we definitely can grow into.
Mm-hmm.
I think our singular focus this year is to get the athlete there. And then once we get the athletes there, then the professionals and those that work with them will definitely come as well. But I think, athletes, and people may not agree with me, but, my take is, athletes are some of the most vulnerable populations there are,
Yes.
because people in organizations and institutions utilize them for, their benefit and maximize their return on investment. But when the athletes are done being a producer in the sports industrial complex, no one's really there to support them in
Mm-hmm.
that transition
Mm-hmm.
in life. And so really want to highlight the athletes and prepare them for success and invest in them more than just dollars and cents. That
Yeah.
is being done a lot now with NIL measures. It's important, but I think investing in them far beyond that, so they can have a life of success, meaning, and wellness, is of utmost importance.
No, absolutely. It kind of takes us back to the story you told me about your path in the beginning, because what I really appreciated about the doctors that spoke to you and planted those seeds of interest in medicine was not just that they did that, but your receptiveness to this. A lot of times when athletes are in the thick of their sport and performance, that's all they're thinking about. Like, how do I attain whatever goal it is? Even if it's an athlete that's academically inclined and they're appreciative of the fact that they're in a position where this is paying for school. But how do you attain what's next? How do you maximize on the position you have right now? Because when you're performing at whatever level it is, high school, college, professional, that's when you have the most attention. That's when you have the most people wanting to offer help. That's when you have the most access to resources. And that's not going to last forever for anybody. It doesn't matter
Right.
how good you are, So I think that's an important, I don't even think it's a side note. I think it's a very important message for the athletes to receive. I'm glad that the spirit of the conference is coming from that too. And maybe to even, you probably already plan to do this explicitly, let them know this, because once that period passes, it's not that your value is out the door, but your visibility and your access is not the same.
Right.
And helping them to understand that. Go ahead. Yeah.
No, I was going to say, and I think the entire sports industry, university institutions, associations, they need to put that on the forefront. It's on the back burner or nowhere to be found.
Mm-hmm.
Maybe in the attic or the basement somewhere, but it needs to be on the front door that your athletic career will 99% of the time end, and you will have to go pro in something other than competing in sports.
Absolutely.
But it's either put on the back burner or it's not even talked about. And when you're done, your eligibility is over, or you have a career-ending injury, or you retire from playing professionally, you're by yourself, and now real life hits. It's like, what am I going to do now that I can't play my sport?
Mm-hmm.
The universities didn't prepare me. The professional organizations and player associations, they had, a summit once a year, but I wasn't able to go because I was at vacation or rehabbing or something.
Mm-hmm.
And so it needs to be put on the forefront that you will not be an athlete, you will not be a competing athlete forever. Yes, you will have the spirit and the identity of an athlete in those accomplishments and all the good qualities that being an athlete has given you.
Mm-hmm.
But it needs to be put on the forefront. And at this point in time is on the back burner. And that's where I think it needs to be a paradigm shift in how we are developing our athletes.
Yeah. Yeah. Absolutely. First of all, 100%. And I think that even as you talk about in the future, perhaps expanding the conference, the fact that right now it's focused on the athlete, that's actually crucial, because that's a message that I would not expect the athlete to get from any of those places, because it's not in those other places' best interest to do that. It's in the athlete's best interest. And that shift in understanding, especially going from, if you're a high performing high school athlete, into the next level of college and then professional afterwards, it's not just a shift in education, it's a huge shift in terms of what sport is and what it's about. It very much becomes a business once you get into the college level and beyond. And that's going to affect relationships. That's going to affect the athlete coach dynamic, the teammates dynamic, especially when there's competition for scholarship spots. And that affects a lot in terms of their experience in sport. So I think that that's a great point, and one that should be made to the athletes. And hopefully there's more physicians like you and I that are willing and able to put that message out there for them, because it's unlikely to come from the places who benefit more, at least they feel in a lot of cases, benefit more from them being singularly focused, or at least majority focused on their sport. So yeah, I'm very glad to hear that that's something that you're driving home for them. What are the ways that you're finding to engage the stakeholders to bring these athletes to these events where you have so much information and knowledge to share with them? How are you going about that?
Well, it's multifaceted, and the one way that I'm finding the best return on my time is really face-to-face interaction, and so talking to them at their schools, at sports showcases, and really meeting them where they're at. Yes, social media and digitally is great, but the old school way of seeing someone face to face, shaking their hand, having a conversation is still, I think, the best way to form relationships, because people, they connect with people. They don't connect with ideas or brands. It's really, they connect with people. And so for me, that's the main thing. I am a sports surgeon, so I am on the sideline, and so interacting with them pre-game, post-game. Also, they're on the social networking apps as well, LinkedIn, Instagram, and so we also have email campaigns, and we are associated and partnered with a few high school athletic associations, most recently Virginia High School League, which is the high school association, the North Carolina Interscholastic High School Association, the Pennsylvania High School Interscholastic Association. And so, they, sending out emails to coaches and the parents about joining in the events. And so multiple different ways. But I think it's ever changing, and we also are want to transition to be doing a podcast as well, that focuses on the transition, and it will be called the Transition Podcast. The trials, tribulations, and triumphs of athletes, and that will be launching March 2nd. And so it'll focus on the transition from high school to college, but also it'll focus on the transition from being college or professional to your post-competing career. And so a lot of the podcasts and stories that we hear are the success ones. But you don't hear about the athlete that was the high recruit, or even a low level or mid level recruit, or a journeyman in a professional league that wasn't an all-star. We don't hear those stories, or we don't hear the stories of trials and tribulations, but they ended up on their feet, or the trials and tribulations, and maybe they didn't have a successful outcome as they want. And those stories need to be told, because those are the majority. The majority is not all-stars, the Hall of Famers. The majority of athletes will become those individuals that no one remembers them as athletes. But I want to highlight them, because those are the stories that will resonate with most of athletes and former athletes.
And it'll give them hope
Correct.
and an understanding that their life, their identity, and their path to success does not end with their time in sport.
Correct.
Yeah, that's a very important message. I mean, I have people I'm thinking of as you're explaining what this is about that I need to connect you with, to talk with. And I have a lot to say on the topic. So I will be expecting to be on there as well.
Of course. Of course. Of course.
So I want to hear a couple other things. When you envision like the perfect future for youth sports and youth mental health in sports, what does that look like for you or to you, and what's your role in it?
So I think for me, and this is my opinion and my ethos, I think there's a collaborative approach, top down, bottom up. One, I think we have to have the buy-in from the parent or the guardian, because it can't just be sport. I want them to be, the best athlete and pro ever, but I want them to care about their child holistically.
Mm-hmm.
And then also from an institution standpoint or a league standpoint, I want them to, highlight and value the mental health aspect and development of the youth athlete. Because if you think about it, truly all youth sport is for character development, right? And for social development. And yes, it's to, develop as an athlete, but really it's to develop well as a person. And so that, and then also the professionals that are involved, I'll speak about sports medicine physicians, for them to value, the impact that mental health has on player performance, player health, player safety, and being an advocate for your athlete, because, and this is my personal opinion, the sports medicine physician, the most good that you can do for an athlete that was injured or maybe have a career ending injury, it's not the surgery you do, but it's helping them be successful in life. It may be connecting them with a sorority or a fraternity member to help them get an internship. It may be connecting them to what's next in life, or maybe helping them to recommend them, writing a letter of recommendation for law school, professional school, medical school, because as a team physician, it's really you care for them holistically in life, not just on the field.
Absolutely.
And so supporting them to be successful and champions in all of life is something else that I think is the role of the sports physician, and not just being on the sideline and doing their surgeries.
Absolutely. Well, I think that vision is beautiful, and the world of youth sports is lucky to have somebody like you working to promote it. So thank you for all of that and for the work that's to come. It's really amazing.
Well, I think it takes a team, it takes a village, as the proverb says, to raise a child, or really to do anything impactful. It takes a team. And I think more collaboration, more willingness to hear variance in thought, diversity of thought, is powerful, because again, if you never think of something, you're never going to enact it. And so it takes multiple different players, interprofessional collaboration. And so it's ironic, but in order to help our athletes, it takes a team, the team behind the team.
I love it. That's right. It does. It does. So now it's time for your What's Good with Dr. Wilsa moment. I would like for you to share whatever else it is. I mean, you've told us a lot, but if there's any other things that are coming up, projects you're excited about, and resources for people, and also just how can people get in touch with you and get involved with the work that you're doing?
So I'll start with connection. You all can connect with me on LinkedIn, William Hill, LinkedIn, based out of Los Angeles. You can connect with Athlete Forever at weareathletesforever.com. You can find us on Instagram at We Are Athletes Forever. Again, the T4 podcast, the Transition podcast, Trial, Tribulations, and Triumphs of the Athlete, will be launching March 2nd. The Mind Games Mental Health Summit for the athletes, we're planning it out. July 18th will most likely be the date. And the award show would be July 17th, and that would be in Los Angeles. And I think, just continuing to build, and meeting people, and having conversations, and that's what I'm doing, and looking to build and help athletes, and give back and invest. Being an orthopedic surgeon, being a sports medicine physician, it's not something I take lightly. I'm here by the investments of others, directly and indirectly, and I think my purpose and calling is to invest in others, because I can only do so much, but people that I've helped, mentored, loved on, cared for, the sum of them is much more than me. And so that's what I'm aiming to do.
That's awesome. Well, thank you so much for sharing all of that with our audience. And I look forward to seeing more of your work and getting involved and helping wherever I can, and just seeing how everything blossoms, because this is truly amazing work that you're doing. So thank you.
We're both doing. Yes.
Thank you. I appreciate that.
Thanks for having me. And I look forward to continuing a great working relationship.
Awesome.